Welcome to our channel. In today's video, we will explore the groundbreaking technology of 3D printed organs for transplants. This innovation has the potential to revolutionize the medical field and address the critical shortage of organ donors. Stay tuned to learn more about this fascinating development, and don't forget to subscribe. Number 5. Revolutionizing transplants. The field of organ transplantation has long struggled with a shortage of donor organs, leaving many patients in need of life-saving procedures without a suitable match. 3D printed organs present a revolutionary solution by offering a way to create organs customized to each patient's unique anatomical needs. By using a patient's own cells to create an organ, 3D printing can provide personalized transplants that drastically reduce the risk of organ rejection. These organs can be constructed to exact specifications, overcoming challenges in finding a compatible donor. When this technology is not limited to creating only simple tissues, but it extends to more complex organs like kidneys, livers, and hearts. As the technology advances, it could significantly improve the availability of organs for transplant and reduce waiting times. This breakthrough may also diminish the need for immunosuppressive medications, which are necessary to prevent organ rejection. Overall, 3D printed organs offer a new path forward, ensuring that patients no longer need to rely on organ donation lists, but instead have access to fully personalized, printed replacements that suit their biological needs. Number 4. Precision medicine. One of the most significant advantages of 3D printed organs is their alignment with the concept of precision medicine. Precision medicine tailors medical treatment to the individual characteristics of each patient, and when applied to organ transplantation, this concept becomes even more critical. A traditional organ donation often involves matching a donor's organ with the recipient based on general factors such as blood type and tissue compatibility. However, this process can still result in mismatches and organ rejection. With 3D printing, organs can be created to match the exact dimensions and features of the recipient's body. This precision helps reduce the chances of complications such as organ rejection. Moreover, 3D printing can incorporate specific genetic material from the patient's cells, further enhancing compatibility. This level of customization increases the likelihood of successful transplants, minimizing the need for immunosuppressive drugs, and improving the overall success rates of organ transplants. As 3D printing technology advances, it holds the potential to redefine how medical practitioners approach not only organ transplantation, but also other areas of personalized healthcare. Number 3, speeding up the process. Organ transplantation is a critical procedure that requires not only a compatible donor, but also timely intervention to save the patient's life. One of the main limitations in traditional organ transplantations is the waiting period for a suitable organ, often resulting in patients enduring extended periods of uncertainty. 3D printed organs offer a promising solution by drastically reducing the waiting time for a transplant. When instead of relying on waiting for a donor organ to become available, a patient could have a custom 3D printed organ created specifically for them in a fraction of the time. This could lead to quicker surgeries, faster recovery times, and a reduced burden on hospitals and medical staff. Additionally, 3D printed organs can be manufactured at a location close to where the patient is being treated, eliminating the need for long-distance organ transport, which often involves delays and logistical challenges. The efficiency of the process would also allow for more patients to be treated within a shorter time frame, effectively increasing the overall number of transplants performed and saving more lives. The potential to expedite the entire transplantation process is one of the key advantages of 3D printed organs. Number 2, ethical benefits. The ethical considerations surrounding organ donation are complex and multifaceted. While organ donation saves thousands of lives each year, the practice raises concerns, particularly with respect to consent and fairness. 3D printed organs could mitigate these ethical issues by eliminating the need for human donors altogether. By creating organs from a patient's own cells, 3D printing would bypass the need for a donor, ensuring that no person is exploited or sacrificed for organ harvesting. This innovation also addresses the issue of organ trafficking, which is a grave concern in many parts of the world. Additionally, the use of 3D printed organs reduces the ethical dilemma associated with organ rejection and the need for ongoing immunosuppressive treatment, which can have detrimental long-term effects on patients. The possibility of creating organs without relying on human sources of donation also helps address concerns about fairness and equal access to healthcare, as there would be no competition for limited donor organs. When with 3D printed organs, the ethical considerations associated with organ transplantation could be significantly alleviated, leading to a more equitable and just approach to saving lives. Number 1. The future of healthcare. 3D printed organs represent a major breakthrough in the future of healthcare, holding the potential to revolutionize how we approach organ transplants and regenerative medicine. In addition to the personalized, ethical, and efficient aspects discussed, 3D printing paves the way for innovative treatments in fields beyond transplantation. The ability to print complex organs and tissues could be used in drug testing, allowing pharmaceutical companies to test medications on living tissue before moving to human trials. This could greatly reduce the number of failed drug trials and streamline the drug development process. Furthermore, 3D printing holds the potential to extend beyond human organs, creating a new era of tissue engineering and regenerative medicine that could treat a range of conditions, from burns and injuries to degenerative diseases. With ongoing advancements in 3D printing technology, the possibility of printing fully functional organs will only continue to improve. This technology may also eventually lead to the creation of organs that could last longer and have better functionality, leading to longer lifespans for transplant recipients. The future of healthcare could be transformed by the widespread use of 3D printed organs, with profound benefits for patients and the medical field. Thank you for watching our video on 3D printed organs for transplants. We hope you found it insightful. If you enjoyed this content, please make sure to hit the subscribe button for more updates on the latest in medical technology.